You wanted to know more about neuro-emotional release using veins and the endocrine system. And that's a class that you are going to love. I use it all the time because it's a way to release emotion with your hands. Sometimes people don't want to dialogue, they don't want to feel their feelings, they don't want to go deep. So I developed this class after I had heavy cases of people that lost their partner, lost their friend, lost their family member. They had big depression, they were already stuck with their emotion, and I was able to release that. That was a protocol that we're going to see at the end of the class. In the class, we are going to start with the inner joy rhythm. It's a way to bring their joy back into their cells. Then we are going to work with intestinal peristalsis, because you know that when you have in hypersympathetic activation, it creates a brake on your GI tract. Less secretion, less reabsorption, less motility, less blood flow. You need to restart the peristalsis, and we're going to work with longitudinal muscle, circular muscle, the plexi of our back, the myenteric plexus, and the plexus of Meissner, submucosal plexus. Then we are going to work with the veins, because the veins are amazing. They are a reservoir of blood. About 72 to 75% of the blood is in veins, and also they are a reservoir of presence and silence. And they all have a different signification. So the facial vein has to do with your mask, showing your face to the world. The palpebral vein could go with the eyes, being seen. The mouth, the labial vein, the lingual vein, to talking, expressing yourself. The arms to do, the legs to be grounded, to receive and go forward, etc. So it's very interesting to work on them and bring that deep silence to your patient, client, to bring them back and release their threshold. And finally, you can have this very special protocol when we find the emotion in the body, or the person can come with an emotion they know, I'm angry, I'm sad, or you can find an emotion in the body, in an organ, in an area. What do you do with that? Or you can try to find limiting belief system, negative belief system, and release that with your hand using a lot of endocrine structures. When I say endocrine, it's not the classical model. I include the skin, that secretes 4 or 5 hormones, the adipose layer, the bones, the heart, secrete ANP, BNP, and other hormones. So you have a lot of areas that secrete hormones in the body. The gastrointestinal tract is the largest endocrine gland, diffuse endocrine gland in the body. It's an enteric endocrine system. So we're going to work on all that, release the emotion. We'll see you at the class. I hope you really like it.